even allowing for factors such as numbers of publications and hours worked, are less likely than men to receive academic promotions, are still underrepresented in leadership positions, even in specialties such as OBGYN, in which we're a majority, and are subjected to sexual harassment ranging from unwelcome bro humor in operating rooms and on hospital rounds to abuse so severe it causes some women to leave medicine altogether. And there's another, more insidious obstacle that you'll have to contend with, one that resides in your own head. At least, that has been the case for me. You see, I've been haunted at every step of my career by the fear that I am a fraud. This fear, sometimes called imposter syndrome, is not unique to women. Your male colleagues also have many moments of insecurity when they're convinced that they alone among their peers are incapable of understanding the coagulation pathway, tying the perfect surgical knot, or detecting a subtle heart murmur. I believe that women's fear of fraudulence is similar to men's, but with an added feature. Not only do we tend to perseverate over our inadequacies, we also often denigrate our strengths. While women like me, white, cisgendered, without disabilities, from privileged backgrounds, commonly experience these feelings of self-doubt, they are even more common and intense for women of color, members of the LGBTQ community, women with disabilities, and first-generation college graduates from poor and working-class families who may arrive at medical school having internalized the prejudices that have been directed at them all their lives. A 2016 study suggested that patients of female physicians have superior outcomes. The publication of that finding prompted much speculation about why it might be so. Perhaps women are more intuitive, more empathic, more attentive to detail, better listeners, or even kinder. I don't know whether any of those generalizations are true, but my personal experience and observations make me sure of this. When women do possess these positive traits, we tend to discount their significance and may even consider them liabilities. We assume that anyone can be a good listener, be empathic, that these abilities are nothing special and are the least of what we have to offer our patients. I have wasted much time and energy in my career looking for reassurance that I was not a fraud, and specifically that I had more to offer my patients than the qualities they seemed to value most. Early on, I believed that displaying medical knowledge, the more obscure the better, would make me worthy. That belief was a useful spur to learning, but ultimately provided only superficial comfort. During my first-year clinical skills course, an oncologist asked me to identify a rash. "Mycosis fungoides," I blurted out, since it was one of the few rashes whose name I knew and the only one associated with cancer. My answer turned out to be correct, causing 3 jaws to drop at once, the oncologist's, the patient's, and my own. But the glow of validation lasted barely the rest of the day. A little further on in training, I thought that competence meant knowing how to do things. I eagerly performed lumbar punctures and inserted central lines, and I applied for specialty training in gastroenterology, a field in which I had little interest, thinking that I could endoscope my way to self-confidence. My first few years in practice, I was sure that being a good doctor meant curing people. I felt buoyed by every cleared chest X-ray, every normalized blood pressure. Unfortunately, the converse was also true. I took cancer recurrences personally. When the emergency room paged to alert me that one of my patients had arrived there, I assumed that some error on my part must have precipitated the crisis. Now, late in my clinical career, I understand that I've been neither so weak nor so powerful. Sometimes, even after I studied my hardest and tried my best, people got sick and died anyway. How I wish I could spare you years of self-flagellation and transport you directly to this state of humility. I now understand that I should have spent less time worrying about being